Hello once again, ladies and gentlemen. Uh, we continue with our lesson 4 in first aid training. And in this part, I want us to cover how to manage wounds or how to do first aid for wounds. So as you know that in first aid, one of the areas that I told you that when you are starting that one of the things that you will be able to get almost all the time is goods, and you must be able to know how you can be able to handle any casualty who has a good. So before we start looking at how to manage the goods, we need to know first of all how are goods, what is a good, and how does it come about. So there are various mechanisms in which goods come about. So when we talk about a wound, it's just it's just the condition where the skin is broken and the tissues, all the inner tissues, are exposed. And this one comes as a result of maybe an external force, which could either be sharp or maybe different opposing forces, which can result to the formation of a wound. So there are different types of wounds. So the first type of wound is a type of wound that we call abrasion wounds. So what are these abrasion wounds? You remember when we were discussing about bleeding, you remember we talked about the external bleeding and internal bleeding. So we discussed about various ways in which bleeding or external bleeding can come about. And you remember we talked about these terms, that the first one is abrasion. So an abrasion type of wound come as a result of the removal of the top layer of the skin. So when the top layer of the skin is removed, that is what we refer to as an abrasion. There is also a type of wound that is created due to a cut on the skin, which results to an irregular edged part, and it is maybe caused by forced tearing away of the skin tissue. And this is what we refer to as a laceration. A laceration is just a cut skin with jagged, irregular edges, and can come as a result of forced tearing away of the skin tissue. Then another type of wound is a type of wound that we call incision. So when you talk about an incision, this is a type of wound that causes smooth edges, and in this case, it resembles that one of a surgical or a paper cut. So usually, this is the type of wound that you experience, for example, when somebody is cut by a laser or something that is sharp like a knife. So if you cut like a knife or a laser, that kind of wound that comes about is what we refer to as an incision. The other type of wound is, of course, what we call the puncture wounds. So when we talk about a puncture wound, this is a type of wound that is deep, and in most cases, the wound is narrow. So because it is narrow, sometimes most people tend to underrate it, because when, for example, someone has been stabbed with a knife, somebody develops these puncture wounds. For example, you have been stabbed by a knife, or you have been punctured by something like a nail or anything sharp. So in most cases, because it does not appear scary on the outside, most people tend to ignore it. But sometimes these ones can be life-threatening, because if it touches or if it affects the inner or the internal organization, that is life-threatening. The other type of wound is what we call an avulsion. So an avulsion is a type of wound where you have this removal of the skin, but not complete. So the flap of the skin is torn, loose, and is either hanging on the body or it is completely removed. So in this case, an avulsion results in the removal of that particular flap of skin. And once it causes that, it can either be hanging or it can be completely removed. So that is a type of wound that we call an avulsion. Then we also have another one that we call amputation. An amputation, I think we discussed this one in our earlier discussion when we were discussing about bleeding. So amputation results to the cutting or tearing off of a body part, such as a finger, a toe, or hand. It can actually result in complete removal of either of these parts, the foot, the arm, the leg, the toe, the hand, or even the finger. So all these, when any of this part is actually removed off by an external force that is acting on the body, it can result to a condition that we call amputation. So amputation clearly means the total removal or the complete removal of a body part. And there are other wounds that we call abdominal and chest wounds, which we say they can be quite serious, because if such wounds happen, because most of the organs are actually located at the chest cavity or the abdomen, or maybe actually in the thorax area. So in this case, these wounds can actually be serious, because whenever these wounds appear or when they happen, they can cause damage to internal organs. And once internal organs are damaged, there could be internal bleeding, which may result to a shock. So in this case, every wound that you realize that is on the chest or in the abdominal area, always treat it with a lot of seriousness and try to address it as fast as possible as you transfer the casualty to the hospital. Because if you don't do so, you are likely to lose that particular patient. So always abdominal and chest wounds are considered an emergency, and always activate your ambulance line whenever you have such kind of wounds. Then while waiting for the medical care, always give the first aid treatment for shock. So try to address the first aid for shock, as we discussed in the other video, that always ensure that this person is treated in such a manner that they cannot go into shock before the medical help arrives, or before these people get to a place where they can be assisted. Then the next part is have the injured person lie quietly on his or her feet elevated above like 12 inches, as we said the other time. This is actually meant to increase circulation and also try to reduce the flow of blood. So in that case, try to assist that casualty to lie down quietly and raise their feet above, or to elevate them like 12 inches, which is above the level of their hearts. Then also try to maintain their warmth. So you can use a blanket, you can cover them so that they don't have a problem where they will maybe lose their body warmth. Then at the end of the day, it can cause another problem. So always try to maintain their body warmth. So the management of wounds is a bit simple, because the first thing, as we said, you start by maintaining the person, or asking the person to remain calm. Try to reassure them that they will get well. And if the wound is on the arm or the leg, you raise it above the heart level. This one, as we said the other time, it slows the flow of blood. Actually, it slows bleeding. So that is one way you can be able to stop the bleeding. If it is bleeding externally, you can apply the pressure, as we said, and also do the dressing so that you can maintain the dressings in place. So if, for example, the person has any obvious debris or body parts, or maybe some objects on their wound, always try to remove them before you cover the wound. So, for example, if the person has any sticks or glass that is maybe protruding from the flesh, try to remove it before you do what? Before you can be able to cover, or before you can try to maybe dress the wound. Also, if the person has embedded objects, for example, if it's a glass, for example, somebody has been pierced, or somebody has been stepped on a sharp kind of glass, then that glass maybe is protruding from the leg or whatever it has sticked. So it's always important that you do not remove the object embedded in the body. Do not remove it, because if you do so, you are actually likely to cause more harm. Try to cover or try to do some dressing with the object there, because when you remove it, it is actually likely to bleed severely. And as a mere first aid, you are actually likely to have a problem controlling the bleeding. So try to avoid removing it. You take the person to the hospital as you apply firm pressure on the wound or on the area that has been affected. Do not remove the bandage, even if you see that the bandage is soaked in blood, because we say that if you remove the bandage, you are likely to cause more bleeding. So always you can remember that. Just add another bandage on top of the other one, so that you can be able to control more bleeding. So when bleeding has stopped, take a clean bandage over the cut, and then you can be able to dress it appropriately. So in terms of management, you seek medical care for that maybe part of the wound that has been affected. So try to take them to the hospital so that they can be able to be checked. So however small it is, always try to ensure that you seek medical attention, because sometimes it may appear small, but it may actually worsen the situation. So if it is jagged or deep, or if it's a puncture wound, try to ensure that you rush the patient to the hospital as fast as possible, as you try to ensure that you treat for shock, because such people are likely to have maybe to develop shock just in case. Then also, if it's on the face, you can be able to try as much as possible. You can manage that by seeking medical care. Also, if that it's an animal bite, for example, it could be a snake or a dog or something, because you must try to take these people to the hospital, because of what? These people are likely to maybe develop complications or other problems. For example, if it's a snake bite, it may appear small, but you need to take these people to the hospital, because it could have been a poisonous snake, which maybe have introduced a poison or a venom into the body. So in this case, always try to take these people to the hospital for medical care. Then if there is that or that won't come out after washing, or take this hospital. So if, for example, someone has all these, always consider taking the people to the hospital, because at the hospital they will be able to do what? To be managed well. So we have said always seek medical care for a cut or a wound. If number one, it is any wound that is on the face, always try to take the casualty to the hospital. If it's as a result of an animal bite, for example, the dog or maybe the snake or anything, try to rush that patient to the hospital, because if it is for the dog, always once they get to the hospital, they will be vaccinated against rabies. Then if it is, for example, the snake, there is a vaccination that is given that we call antivenom. So this one is always given to any person who has been bitten by a snake. Then if that person has bleeding which is not stopping because of maybe a condition of the body where the blood is not stopping easily, or when it's not stopping, there could also be a factor that maybe some of the major vessels have been affected, or the major arteries. And once the major artery or vessel is cut, then there is a possibility that this person might bleed for longer. So always take the person to the hospital if it is not if the bleeding does not stop. So that is a topic on that's a short topic on how you manage a bleeding casualty. So if you is how you manage them. Then the next type of patient that I want us to handle, or that casualty that we want us to handle, is a casualty who is fainting. So fainting usually occurs when your brain temporarily doesn't receive enough blood supply. So when somebody has no enough blood supply into the brain, it causes the loss of consciousness. So once that person loses consciousness, the next thing is the person to fall down. So when they fall down, in this case, is what we refer to as fainting. So this is similar to shock, except that with shock, it is a temporary condition, but no. With fainting is is what we call a temporary condition, because with fainting, once the person falls down, after some time they regain. So what causes this? So it is usually occurs because of a temporary decrease of blood flow to the brain. So once the blood flow to the brain is interrupted, so there are high chances that this person is going to do what? To faint. This one can be caused by not eating properly. There are some people who get to faint or get this condition by not eating properly, or standing up too fast. There are those people who, when they stand too fast, they are likely to have this condition of fainting. Or they are standing for too long. For example, you remember when we used to stand for too long in the assemblies. So sometimes you would see some people falling down because the blood is not circulating well to the brain. Then low pressure. So if somebody has low pressure, so this person is also likely to develop the signs. So the signs and symptoms of this is that the casualty feels fainty and collapses. Then the management for this is, as we have already said, you do, if the person has already fainted, you allow them to lie down, and this will keep the circulation, or this will improve the circulation of blood to the brain. So if they faint, they will usually wake up after a few seconds, especially if you allow them to lie down flat, or maybe you raise the feet higher than the other part of the body. So this one allows blood to circulate to the brain, and eventually the person becomes better. If they do not wake up within 1 minute, or they become injured during the fall, then always activate the ambulance line. Try to ensure that you get the medical help as soon as possible, and treat for any injuries that may have been incurred. Position the person on their back and try to raise their legs higher, so that you can be able to increase the circulation. Check for breathing. Always check for breathing, so that you are able to ascertain if the person is maybe getting better. So try to check the breathing, try to check the responsiveness, and always try to loosen their clothes, so that you can be able to do what? To allow them have enough circulation of air, so that the blood can circulate well to the brain. So as you can see from the photo that I had attached there, the young lady who is trying to help this lady here, as what she has done is to make the person lie down flat, and she's now calling for help, so that she can be assisted to take care of the person, or to take them to the hospital. So that is how we manage fainting. You can be able to see the next photo, that is picture 2, where the person has been allowed to lie on their back, and then after lying on their back, the legs, you can see, have been lifted higher using that wooden rock, so that you can be able to increase circulation to the brain. So That is how you can be able to manage fainting casualty. So whenever you find a fainting casualty, that is how you can be able to handle that. So thank you so much for listening, and thank you so much for watching today's lesson. If you have not subscribed to our channel, always do so that you can be able to get any future tips on how to manage various emergencies in our homes. This is Shining Institute Online Training Center. Thank you.